Hello friends, welcome to my YouTube channel Universe of Radiology. So today we will discuss about the further question of topic radiotherapy and chemotherapy. So here we start. Which is used in teletherapy and brachytherapy both? Options are option A iridium 127, option B cobalt 60, option C palladium and option D is iodine 131. So the answer of this question is option B, that is cobalt 60. Next question, radioactive phosphorus is used in the treatment of option A polycythemia rubra vera, option B thyroid metastasis, option C multiple myeloma, option D embryonal cell carcinoma. The answer of this question is option A, that is polycythemia rubra vera. Next question is which of the following element is obsolete in radiotherapy? Options are option A radium 226, option B cobalt 60, option C iridium 192, option D cesium 137. So the answer of this question is option A, that is radium 226. Next question, features of interstitial radiotherapy are all except. So options are option A only used in head and neck, option B damage to normal tissues, option C temporary or permanent, option D only iridium used, and option E is used for easily accessible organ. So the answer of this question is option A, option B and option D. Option A is only used in head and neck, option B is damage to normal tissue, and option D is only iridium use. So except all these, all other are the feature of interstitial radiotherapy. Next question, MC cancer due to radiation. Option A leukemia, option B bronchogenic CA, and option C thyroid CA, and option D is breast cancer. So the answer of this question is leukemia, that is option A. Next question, stereotactic radiosurgery uses all except. Options are option A proton, option B electron, option C linear accelerator, and option D is gamma knife. So the answer of this question is option B, that is electron. Next question, isotopes used in relief of metastatic bone pain includes. Options are option A strontium 89, option B I-131, option C gold 198, option D P32, and option E is rhenium 186. The answer of this question is option A, that is strontium 89. Next question, the technique employed in radiotherapy to counteract the effect of tumor motion due to the breathing is known as. Options are option A arc technique, option B modulation, option C that is gating, and option D is shunting. The answer of this question is option C, that is gating. Next question, hyperfractionation radiotherapy is used in the management of. Options are option A lung cancer, option B breast cancer, option C seminoma, and option D is ovarian cancer. The answer of this question is option A, that is lung cancer. Next question, radiosensitizer drug is or are. Options are option A mesonidazole, option B actinomycin D, option C oxygen, option D hyperthermia, and option E is amifostine. So the answer of this question is option A, option B, and option C. So radiosensitizer drug are mesonidazole, actinomycin D, and oxygen. Next question, which of the following statement about stochastic effects of radiation is true? Options are option A, severity of effect is a function of dose. Option B, probability of effect is a function of dose. Option C, it has a threshold. And option D is arrhythmia and cataract are common examples. So the answer of this question is option B, that is probability of effect is a function of dose. Next question is most radiosensitive tissue of body among the following is. Options are option A, bone marrow, option B, spleen, option C, kidney, and option D is brain. The answer of this question is option A, that is bone marrow. Next question, low dose radiation causes. Option A, lung cancer, option B, AML, option C, cervical cancer, option D, glioma, and option E is meningioma. So the answer of this question is AML. Next question, post radiation transverse myelitis usually present as white urine after radiation therapy. So the options are option A, 1 to 2 weeks, option B, 1 to 2 months, option C, 4 to 6 months, and option D is 1 year. So the answer of this question is option D, that is 1 year. Next question, the maximal permissible radiation exposure per year recommended by NCRP for radiation worker is. Options are option A, 3 RAD, option B, 8 RAD, option C, 10 RAD, option D, 50 MSV. So the answer of this question is option D, that is 50 MSV. Next question is point A and point B Manchester location are important for treatment of which cancer? Options are option A, cervix, option B, vagina, option C, ovary, and option D is uterus. The answer of this question is option A, that is cervix. Next question, maximum recommended external beam radiation therapy dose for a case of carcinoma cervix is. Options are option A, 80 GY, option B, 70 GY, and option C, 50 GY, and option D is 35 GY. So the answer of this question is option C, that is 50 GY. Next question, photodynamic therapy with lematoporphyrins and light is increasingly used in treatment of. Options are ovary CA, options B is skin CA, and option C is colon CA, and option D is all of the above. So the answer of this question is option B, that is skin CA. Next question, the ideal timing of radiotherapy for Wilms tumor after surgery is. Options are option A is within 10 days, option B is within 2 weeks, option C is within 3 weeks, and option D is any time after surgery. So the answer of this question is option A, that is within 10 days. The ideal timing of radiotherapy for Wilms tumor after surgery is within 10 days. Next question is, at T is equal to 0, there are 6 into 10 23 power and radioactive atoms of a substance which decay with a disintegration constant equal of 0.01 per second, what would be the initial decay rate? So the options are 6 into 10 to the power 23, option B 6 into 10 to the power 22, option C 6 into 10 to the power 21, option D 6 into 10 to the power 20. So the answer of this question is option C, that is 6 into 10 to the power 21. Next question, all features of radiation except option A biological, option B photographic, option C fluorescent, option D non-penetrating. The answer of this question is option D, that is non-penetrating. Next question, most stable radioisotope among the following. Options are O18, option B C14, option C P32, option D I125. The answer of this question is option A, that is O18. Next, which is not a deep heat therapy? Options are option A short wave diathermy, option B infrared, option C USG, option D microwave. The answer of this question is option B, that is infrared. Next, radiation produces its effect on tissue by. Options are option A coagulation of cytoplasm, option B increasing the temperature, option C charring of nucleoprotein, and the option D is hydrolysis. The answer of this question is option C, that is charring of nucleoprotein. Next question is gray equals option A 100 RAD, option B 1000 RAD, option C 10,000 RAD, and option D is 10 RAD. The answer of this question is 100 RAD, that is option A. Next question, Curie is unit of. Options are radiation exposure, that is option A, option B is radiation absorption, option C radioactivity, and option D is all of the above. The answer of this question is option C, that is radioactivity. Next question, most commonly radiotherapy uses. Options are option A X-ray, option B alpha rays, option C is alpha rays, option B is gamma rays, and option D is electron. The answer of this question is option A, that is X-rays. Next question, which of the following radioactive isotopes is not used for brachytherapy? So the options are iodine 125, option B iodine 131, option C cobalt 60, and option D is iridium 192. The answer of this question is option B, that is iodine 131. Next question, isotope used in radioactive iodine uptake is. Options are I131, option B I123, option C I125, and option D is I127. So the answer of this question is option B, that is I123. Next question, all of the following radioisotopes are used as systemic radionuclides except option A phosphorus 32, option B strontium 89, option C iridium 192, and option D is samarium 153. The answer of this question is iridium 192, that is option C. Next question, which one of the following radioisotopes is not used as permanent implant? Options are option A iodine 125, option B palladium 103, option C gold 198, and option D is cesium 137. The answer of this question is option D, that is cesium 137. Next question, radioisotopes are used in the following techniques except. Options are option A mass spectroscopy, option B RIA, RIA. Next, option C ELISA, that is enzyme linked immunosorbent assay, option D sequencing of nucleic acid. The answer of this question is option C, that is ELISA, that is enzyme linked immunosorbent assay. Next, which of the following radioisotopes is commonly used as a source for external beam radiotherapy in the treatment of cancer patients? Options are option A strontium 89, option B radium 226, option C cobalt 59, and option D is cobalt 60. So the answer of this question is option D, that is cobalt 60. Next question, longest half-life is seen in. Options are option A radon, option B radium, option C uranium, option D is cobalt. The answer of this question is option C, that is uranium. Next question, the half-life of cobalt 60 is. Options are 3.4 year, option B 5.2 year, option C 1.2 year, and option D is 2.3 years. So the answer of this question is option B, that is 5.2 years. Next question, half-life of I-131 is. Option A 4 hours, option B 8 days, option C 4 days, and option D is 10 days. So the answer of this question is option B, that is 8 days. Next question, the half-life of technetium is. Options are 6 hours, option B 12 hours, option C 24 hours, and option D is 60 hours. So the answer of this question is option A, that is 6 hours. Next question, radium emits which of the following radiation? Option A alpha rays, option B beta rays, option C gamma rays, option D X-rays, and option E is neutrons. So the answer of this question is option A, option B, and option C, that is alpha rays, beta rays, and gamma rays. Next question, radiation emitted by IR-192. Options are option A 0.5 MeV, option B 0.6 MeV, and option C 0.66 MeV, option D 0.666 MeV, and option E is 0.47 MeV. So the answer of this question is option C, that is 0.66 MeV. Next question, phosphorus 32 emits. Option A beta particles, option B alpha particles, option C neutrons, and option D is X-rays. The answer of this question is option A, that is beta particles. Next question, most suitable radioisotope of iodine for treating hyperthyroidism is? Options are option A I-123, option B I-125, option C I-131, and option D is I-132. The answer of this question is option C, that is I-131. Next question, maximum dose of radiation per year in a human which is safe is? Option A 1 RADS, and option B 5 RADs, and option C 10 RADs, and option D is 20 RADs. The answer of this question is option B, that is 5 RDS. Next question, maximum permissible radiation dose in pregnancy is? Options are option A 0.5 RAD, option B 1.0 RAD, option C 1.5 RAD, and option D is 5 RAD. So the answer of this question is option A, that is 0.5 RAD. Next, most sensitive tissue to radiation is? Option A liver, option B gonads, option C spleen, and option D is skin. The answer of this question is option B, that is gonads. Next, the cell most sensitive to RT. Options are option A neutrophil, option B lymphocyte, option C basophil, and option D is platelet. So the answer of this question is option B, that is lymphocyte. Next question, the radiation tolerance of whole liver is? Option A 15 GY, option B 30 GY, option C 40 GY, and option D is 45 GY. So the answer of this question is option C, that is 40 GY. Next question, most radiosensitive stage. Options are option A S phase, option B G1 phase, option C G2 phase, and option D is G2M phase. The answer of this question is option D, that is G2M phase. Next question, photon transferring some of its energy to electron is? Options are option A photoelectric effect, option B Bremsstrahlung effect, and option C is Compton effect, and option D is ionization. The answer of this question is option C, that is Compton effect. Next question is photoelectric effect is? Options are option A interaction between high energy incidence photon and the inertial electron, option B interaction between the low energy incident photon and the inertial electron, option C interaction of the incident photon with a nucleus, option C interaction between a photon and electric current. So the answer of this question is option B, that is interaction between the low energy incident photon and the inertial electron. Next question is ionizing radiation is most sensitive in? Options are option A hypoxia, option B S phase, option C G2M phase, and option D is activating cell. The answer of this question is option C, that is G2M phase. So thank you all and have a nice day.